Welcome to the AUA News Inside Tract Podcast. Today's podcast is brought to you by the AUA's Residents and Fellows Committee. Dr. Ramzy Burns, a female pelvic medicine and reconstructive surgery fellow and recent urology residency graduate at Indiana University, sits down with Dr. Benjamin Schmeusser, a urology intern at Indiana University, to discuss his unique path into the field of urology without having a home residency program.
Hi everyone, my name is Dr. Ramzy Burns, and I am a recent urology residency graduate from Indiana University, and I'm currently completing a female pelvic medicine and reconstructive surgery fellowship at Indiana University. And I have the pleasure today of interviewing Dr. Ben Schmeusser, who's one of our new interns at Indiana University. And his story is a little bit unique because he did not have a home urology program. And so we're going to talk about what that's like and how he got interested in the field and kind of what his path was to get to residency at this point. So Dr. Schmeusser, if you just want to introduce yourself, tell us where you are from, and we can start with that.
Hey, Ramzy. Yeah, I'm from Cincinnati, Ohio originally, and then I ended up doing my undergrad at the University of Dayton. And following that, I did my medical school at Wright State University Boonshaw School of Medicine, which is also in Dayton, Ohio. And that kind of brings us to our topic today. It's a program without a home urology program, so that was a really interesting way to go about applying to urology.
And when did you first know that you were interested in pursuing urology?
Yeah, I think the first time I even heard of urology as a field is probably my second year of medical school. I was not somebody, you meet a lot of people when you're applying that either worked as a scribe in urology or did something with urology before even getting to med school, and it was kind of their dream all along. For me, it was kind of offered to me by people who actually knew what urology was. So it was more so probably second year when I was trying to figure out what to do. People that knew what urology was kind of felt like, first off, my personality catered a little bit towards that field, and then also what I was looking for in a specialty could be found in urology.
And can you tell us a little bit more about those relationships, who those people were that first introduced you to the field? Yeah,
I would say I probably have two people that I think, at least med students that I knew that particularly kind of encouraged me to check it out. And that was Hannah Levine, who's now a radiology resident at the University of Cincinnati, and then Joe Wiedemer, who's actually a urology resident at Brown. And Joe was one of the people that did scribing and worked at a urology private practice for a while. And then Hannah, her dad was actually a urologist up in Cleveland. So when I kind of told them I was looking for a surgical field, a field with, clinical expertise, but also surgical expertise, a diversity of types of things you can do in the operating room and types of careers you could have. And then also a field that had an intimacy to it and also kind of a vulnerability to it with the patients. They just kind of thought like urology was kind of the perfect fit for that. And now that I'm in it, they couldn't have been more right, but I didn't know it even really existed much before that.
Yeah. So walk me through, you're a second year medical student now. You're still probably in clinical or preclinical work at that point. And you realize that you might be interested in the field, but probably also realize that your medical school does not have any exposure to the field. So what did you kind of do at that point to start seeing what a urologist actually does?
Yeah, so that's the biggest difference between a place with a home program and a place without. I couldn't just walk down to the urology department and say, hey, what is this field? I couldn't just kind of do a rotation. So what I did, there was probably 4 or 5 people ahead of me over the past few years that had matched into urology. A couple of them, one went to Case Western, one went to I think it was Albany or Memphis. So I reached out to all those guys and said, hey, what did you do to get into urology? And each of them kind of all did something different. But there was a local mentor in town who had usually taken people under his wing and let them do like a 2 to 3 week rotation with them during their surgery block. Unfortunately for me, that guy had moved from Dayton to Columbus for a different job, but that's only around an hour drive. So I just did, an hour commute for 3 weeks just to check things out. And so I talked with him, I met with him. He was very encouraging, wanted me to really check things out. And I went up to his office in Columbus. I got to rotate with all of his partners and kind of got a full spectrum urology rotation with him for a couple weeks before, finishing my surgery rotation, my third year.
Okay. And so your medical school is pretty flexible then in terms of saying, I'm interested in this field and allowing for you to have the time to explore it.
Yeah. So, and I don't, again, I can't really speak on other medical schools, but my medical school is actually very open to that. They've had, instances of that in the past. I did have to design my own rotation, create kind of, a syllabus and go over it with the doctor, which was actually a pretty good experience too, in learning how to do that. But we had to, make it official, but they were very, anything they could do to help me, they could. They just knew their resources were a little bit limited.
Okay. And because it wasn't an academic, I'm guessing it wasn't an academic practice that you were necessarily seeing.
Yeah.
How did you, I guess, get exposure to what an academic urology practice or residency program might look like?
Yeah. So that first rotation, it was not academic per se, but they did have their practice was large enough where they had somebody doing more of the reconstructive stuff, somebody doing more of the oncology stuff. Somebody, there was even gender affirming care there. So it was a pretty well-run private practice, but again, it was private practice or community-based. It wasn't very academic. So for more of the academic side of things, I actually reached out to all the local medical schools around me that had urology programs and said, hey, I'm really interested. I don't have a home program. Is there any research opportunities? Is there any other opportunities you have available to me? And I actually got quite a few research projects and at least research experiences under my belt, which hindsight, I actually wish I had maybe done a little bit more aggressively and pursued those a little bit earlier on. But I was able to develop some relationships that way. And this was all before, my fourth year where I ended up doing AUAs and all that.
Right. And so it sounds like maybe the people in the community-based urology practice were mentors to you, but were you able to find mentors in any other way that helped you kind of through this process?
Yeah. So I had two community-based urologists that were very influential in helping me decide, where to do AUAs, how to do that, how to kind of go through that whole process. And I actually had one that actually had me, set up a mock sub-I presentation when I was doing an AUA, which was really, really helpful. But then on the more academic side of things, I did have a mentor down at the University of Cincinnati, Dr. Abhinav Sadana, who kind of treated it more like I was one of their home students, especially in terms of research, but then also in terms of just like advice on how to apply, because he was kind of in it more so at the moment than some other people.
Okay. And so then you're kind of entering at this point, you want to do the field of urology. And so you're entering your fourth year. How did you go about setting up sub-Is? I know some sub-Is require letters of recommendation before applying to them in the first place. So what was that process like for you?
Yeah. So, and this is where my stories meet different than people find out, because when I was a fourth year, there's still COVID restrictions. So the restrictions were for people with home programs, they can only do one AUA. And for people without home programs, they could do two AUAs. And I don't know what the restrictions are nowadays, but previously for the people that applied before me, they encouraged 3 AUA rotations for us because we didn't get that home rotation, which is kind of an AUA already. Right. So the goal was to pursue 3 AUA rotations. I was only allowed 2 with COVID restrictions. And then also before those AUAs, I arranged with my local mentors a pseudo home sub-I rotation where they pushed me a little bit more than just a medical student. And then, like I said, I actually was able to give a sub-I presentation to the partners, which was very, very helpful now I'm looking in hindsight, because I didn't know sub-Is did that when they went on AUA rotations. I didn't know that you were supposed to give a presentation. I didn't know all of that type of stuff, which I was very fortunate to get that kind of pseudo exposure.
Yeah. And then how did you find, well, I guess your sub-I experiences were all virtual. So how did you find that to be different than kind of your quote home program or home pseudo program experience?
Yeah, so I actually was able to do the sub-Is in person. It was just a limited number of them. So I was able to go to them. So the biggest difference, I would say, from those community practices, from what I was doing and kind of the experiences I had, was number one, working with the residents. When I was on all these, community rotations, I was kind of the main focus. There was no residents around, which was really great for hands-on learning. But it was different for working with residents and kind of seeing that whole dynamic. And I think that brings on not only just like learning and understanding a residency, but then also a whole different social dynamic to be considering when you're working and how to, kind of fit in and how to be socially present, but not, not too pushy, because residents are very busy. So I think we've all had that experience where it's like that. I would say if you want to compare it, it's very similar to a surgical residency. So making sure you get some home general surgery exposure or surgical oncology or something where you're seeing a busy residency program and how surgical residents interact and kind of how the normal workflow in the morning of a residency goes.
Yeah, that makes sense. Going back to kind of getting your letters of recommendation. So how did you go about doing that? Who did you obtain them from leading up to your application cycle?
And I think I forgot to answer from your last question as well about preparing for the sub-I and getting a letter of recommendation for that as well. So I had to get 2 letters of recommendation, I think, for some of the sub-Is, and I used both of the community urologists that I rotated with, and they were very aware of kind of how the letter should look and what it should say. So I think if you have local urology mentors, I think that would be great. If you don't have any urologists at all, I would assume, or I would think that maybe reach out to your surgical department and seeing, number one, if they have any people that you could work with locally at that hospital, or number 2, if they can write a letter for you on behalf of the department. I think urology programs are looking for the urology letter, but if you're confident in last resort, that'd be a good place to start. And then for the actual application cycle, I had learned that urology people like urology letters. So I didn't get any letters from anyone other than urologists. And I made an effort on my sub-Is to arrange meetings early with the PD, with the chair and everyone, and explain that my intention was to get a letter for that rotation, and then to also ensure that I, double check that and ask for it by the end of the rotation after setting up a meeting with the program director and the chairs.
So as you went into the application cycle, did it look like, because I think you usually can have about 4 letters going out, sometimes more, and you can pick and choose, but did you have basically 2 letters from your community urologist and 2 from your sub-Is? Does that sound
Yeah, so I had 2 from there, and I actually had another one from somebody else from my sub-Is that I met along the way, and then I was actually able to, use different ones for a couple of different places. But I ultimately had 4 urology letters, and I would, again, I think that's probably the smart way to do it, is to do all urology letters, unless you maybe did a PhD or something where you had extensive work with, say, another type of faculty person. But then also to always get another letter from somebody that's maybe not a urologist, if you don't have another urologist, just in case somebody doesn't get their letter in on time or something like that, because you don't want to not meet the bare minimum when you're applying. So, but again, I think having all urology letters is probably the best way to go about it.
Yeah. And then tell me, so as you went through the application cycle, because it is such a small niche community and it's like everybody, especially in academics, everybody seems to know everybody. Did you feel like you were given a disadvantage due to the fact that you weren't coming from a program that was known? And how did you kind of handle those situations?
Yeah, so I think, that's probably the biggest disadvantage is not coming from a home program, is you're coming from a place that people might not even know the medical school name. My medical school wasn't a small, really new medical school. It was a well-established medical school, but no one really knew where it was. Because there's no urology, there wasn't, a faculty that I had seen every day throughout the halls that people had known. So that was probably the biggest hurdle, was coming from a place where you don't have the tight-knit relationships to people that everyone in urology has tight-knit relationships to. I wouldn't say necessarily coming from a medical school without a home program wasn't the problem, but again, that faculty interaction with people they know was the biggest hurdle.
Yeah. And so, as I know, and obviously you've been through it, you didn't match during the first cycle. And so tell me, I guess, what types of experiences did you seek out afterwards to further enhance your application for the next round of applications?
Yeah. And, I didn't match that first time around, which I did think was kind of a surprising thing. I don't necessarily know whether or not the home program was limiting. I had, 14 interviews. Things were looking very good for me. I think it was a very competitive year that year. But then I do think when kind of like to your question, what was I looking for? Not having that home program and not having that mentorship that really could, not only teach me and encourage me and give me opportunities to become a good urology applicant, but then also to direct me a little bit more in the know of the whole application process and have those relationships that they could help, when they see the letter, they recognize that name as somebody that's well respected and established in the field. That's what I was really, I think, missing hindsight. I felt like I had good relationships on my sub-Is and with the people I met along the way, but I think that was the biggest kind of misstep for me. So I think when looking for those experiences, I was really looking for my year in between applying and reapplying to fill that void. So, and this is for, not only people without home student programs, but with people even with home programs that don't match. The first thing I did, and the first thing I think anyone should do is be on Twitter, because that's where everything kind of happens now. And people will be putting out position openings for research positions. And then you also have the option of doing another specialty entirely, because we have urology match. So you could actually switch it up entirely. That wasn't going to be an option for me. And you could also do a sub-I experience, prelim year experience, and usually general surgery would be, and then reapply that way. So what I was looking for particularly was a research year, so I could get that close mentorship with somebody that's, respected in the field, and then also improve my CV at the same time.
Yeah. And I know you went to Emory, right, for your research year. And from what I heard from you, it was a fantastic experience for kind of all of those goals that you just said, right? And so how did you decide, whether or not to do a research year, whether or not to do a prelim year, or kind of the other options? Yeah.
I'm glad you're asking that, because I think it's easy for me to maybe encourage somebody to do the research year, but I think it could also be very detrimental if it's not for the right person. So I think first off is deciding whether or not you want to keep doing urology. And then second off, the way I learned about this and was kind of informed about this was one of my community mentors actually had a friend in residency at urology residency who originally didn't match, and kind of learned this from him. So it's kind of all been passed through the grapevine. And I talked to a lot of other people that had very, very similar advice, but the advice is, again, either surgery prelim, and if you do a surgery prelim, try to get rotations early with the urology department at your prelim institution to try to get another letter and try to impress them before applications start up. But then also the urology research year, which is a year where you are completely dedicated to the research, to whoever you're researching with, and you try to impress them as much as you can. And at the same time, try to improve your CV for urology. So get new letters, but then also be a better applicant. And again, the reason I went with the research was to look for that kind of one-on-one mentorship, to be in the urology field for the first time without having a home program. And I also felt like my personality was going to be a good fit for the research year. It's for people that hate research, or for people that think having no schedule, I would completely advise would be terrible. I would completely advise against the research year, because you could maybe shoot yourself in the foot a little bit and make a bad impression, and then have wasted a year doing research and not being productive at it. So I think people really need to be honest with themselves. If they're going to hate their lives every day, if they're going to not want to do the research at all, if they're not going to be able to, show up when no one's watching and do the research because you're the only one really holding yourself accountable, I would say it's okay. Maybe search out the prelim year, because the last thing you want to do is make a bad impression. But if you're somebody that thinks you're up for that opportunity, I think a research year is a great year to pursue those things.
Yeah. And then during your research year, did you do additional sub-Is in that summer leading up to the next application cycle?
So you're not allowed to do anything like that, because you lose all of your medical school privileges of being able to rotate and all of that. So you do lose that, which is a disadvantage. There are some people that actually delay graduation for the year. And I do think that they might retain some of that ability. It's just more of a matter of scheduling then. And if, I don't know if my Twitter gets put out with this or anything, but I have people that I know that did that can always give their contact information if somebody ends up being in that boat. But what I did do was pursue shadowing experiences at Emory. and I would shadow in clinic. I would shadow in the OR a little bit. Obviously, most of my time was spent doing research and helping out with those responsibilities. But there were some clinical exposure through that year that I thought was really unique and helpful.
Okay. And kind of hindsight's 2020, but what would you have done differently, if anything, in your first application cycle?
Yeah, I think on my sub-Is, I think I maybe tried to play it cool a little bit too much. I don't mean you should be overbearing, but I think I could have been a little bit more proactive. I think I could have been a little bit more intentional with my interactions with everyone around me. I think, you're kind of juggling this, like, don't be too much, but then also be present. So I think those interactions could have been a little bit stronger. I think vocalizing my interest in programs and people and really just kind of being vocal about, because sometimes you're at a place and you really like something, but you don't want to be just out saying it. So I think expressing what you like and that you like a place and everything like that is completely okay. I think in terms of pursuing relationships and opportunities beforehand, I should have probably been more aggressive of just cold emailing and Twitter direct messaging and just reaching out to places I was interested in, because now that I'm on kind of the other side of it, it's not weird when you're a medical student doing that. No one's going to judge you for it. The worst they'll do is just not respond to the email or the direct message.
Yeah.
So I think I could have been a little bit more, I guess, upfront and direct about those types of things and been a little bit more proactive.
Yeah, that's great advice. And kind of, then going into your second application cycle, what are a few things that you did do differently as you applied the second time?
So I could tell with my second time around, the biggest difference was having that relationship with my faculty, my research faculty that, were well respected and established in the field. I could tell that the fact that I had a successful research year and that it had made a good impression on them, that reflected in my letters. So again, not to say you need to do a research year to get that, but to just make sure you develop those relationships. And I think I had done that through my research year, which is really helpful. I do think having some urology research was helpful in the second time around. I had a little bit before, but I had a lot more this time, which I don't think programs are looking for a full catalog of research papers or anything like that. I think as long as you have something to talk about, it's really helpful. But I think the fact that this time around I had kind of multiple different areas of research and topics to relate to my interviewers was really, really helpful, because not everyone's interested in oncology. Not everyone's interested in reconstruction. So just having a little bit of different things to talk about was really helpful.
Yeah. And if you could kind of sum up things, so talking to a medical student now, or when someone, reaches out to you, what are some general pieces of advice you have for medical students who do not have a home program?
Yeah, and I've actually talked to quite a few now, because after not matching, I was able to talk to a few students that had home programs and some that didn't when not matching. But and I talked to my medical students at my home program still. I think first off is figuring out whether or not urology's for you and getting that exposure. So setting up some type of rotation, seeing what it has to offer is a great first thing to do. And then second is kind of some stuff we've already talked about is really just kind of being proactive. And if you see somebody on Twitter that you're like, hey, that person's interesting, they look like they know what they're talking about, they look like somebody I could get to know and maybe a good mentor, don't be afraid to just send that email or that direct message and try to make that relationship, because those relationships can end up, secretly going a long way. And I think with those interactions, maybe saying, hey, do you have any lingering research projects or review articles or something that I can help out with? So they not only know you as a nice person, but know a little bit more about your work ethic and things like that. And then I think when it comes to the more official things like applying for sub-Is and away rotations, I think a couple things. I think thinking about your sub-I location and your away rotation locations is a big deal. Not only geographically, but then also just kind of the people at the program and what types of relationships you can build there. Because again, the biggest hurdle would not be not having those relationships at your home institution. So maybe picking places that have a well-connected and well-respected, presence in the field, which I think most programs do. But I think just making sure you're cognizant of what the reputation is and what the program's like before going into it would be great.
Yeah.
And kind of with that, I don't think it'd be weird if a medical student direct messaged a resident at a place and said, hey, can you have advice or insight on your program? I think at least everyone I talked to at IU would be very, very open to explaining what IU is like, how the sub-I rotation works and all of that stuff. I think most residents would be open to that.
Yeah, as a former resident, I can attest to that. So, well, that was all wonderful advice. And it's just, I'm very thankful that you were able to share your story with us. And I know it'll be very helpful for so many medical students moving forward. As you mentioned several times, medical students are welcome to reach out to you. They're welcome to reach out to me or any of us really at Indiana University or around the country that are urologists, because the field is small and we're all willing to help each other out to get there. So thank you so much for your time, Dr. Schmeusser, and I hope you have a good rest of your day.
Yeah, thank you so much.
This has been an AUA News Inside Tract podcast, brought to you by the Residents and Fellows Committee. For more information about the AUA and AUA membership, visit auanet.org/membership.